Hi friends, how are you today? I hope you're doing well, and even if you're not feeling great, that's okay too. We've all been there. Today, I want to chat with you about something you may have heard of, or maybe even experienced yourself: OCD. What exactly is OCD? Maybe you've heard someone say, "I'm so OCD. My desk has to be super tidy." But is that really OCD? Well, let's dive into this topic together at a relaxed pace, no judgment, and with open hearts. What is OCD? OCD stands for Obsessive Compulsive Disorder. It's a mental health condition characterized by two main elements: obsessions and compulsions. These two terms might sound heavy or unfamiliar, but don't worry, we'll unpack them slowly, one step at a time. Understanding obsessions. In the context of OCD, obsession isn't just about being obsessed with someone or something like in the movies. In the mental health world, obsessions are recurring thoughts, urges, or images that are intrusive and unwanted. These thoughts can be extremely distressing, anxiety-inducing, or even frightening. For example, someone might constantly think about germs and cleanliness, fearing their hands are dirty and could spread disease. Or someone may repeatedly think, "Did I lock the door?" even after checking multiple times. Obsessions can come in many forms. Intrusive thoughts about harming oneself or others without any desire to do so. Intense fear of losing control. Excessive doubt. Religious thoughts taken to extremes. Scrupulosity. Fear of contamination from dirt, chemicals, or germs. Understanding compulsions. Compulsions are repetitive behaviors or mental acts performed in response to an obsession. The goal? To reduce anxiety or prevent something bad from happening. But sadly, compulsions often end up reinforcing the OCD cycle. Compulsions can include excessive hand washing, repeatedly checking doors, stoves, or locks, mentally counting certain things, arranging items in a specific order, praying or repeating certain words in the mind to feel safe. For instance, someone afraid of getting sick might wash their hands 50 times a day. Or someone scared they left the stove on might go home from work just to check even when they know they turned it off. OCD is not just being neat. We often misunderstand OCD. Many think it's just about liking cleanliness or order. But what people with OCD feel is way more complex and emotionally draining. If you or someone you know spends hours doing repetitive tasks and feels extreme anxiety if they don't, it might be more than just neatness. It's not about liking things tidy. It's about a deep urge to reduce overwhelming anxiety. When does OCD start? OCD can begin at any age, but it often starts during adolescence or early adulthood. Sometimes symptoms appear in childhood, but they might not be recognized until later in life. Types of OCD. OCD can take many forms, and each person might experience a unique combination. Here are some common types. 1. Contamination OCD, fear of germs, dirt, or contamination. 2. Checking OCD, obsession with making sure things are done, like locking doors or turning off appliances. 3. Symmetry and order OCD, urge to arrange items in a particular order. 4. Harm OCD, recurring thoughts of harming oneself or others, even if there's no intention. 5. Sexual or religious OCD, disturbing thoughts or images that go against personal beliefs. 6. Hoarding difficulty, throwing things away due to fear of losing something important. How OCD affects daily life. OCD can impact many aspects of life. Social life. People may withdraw due to embarrassment or fear of being judged. Work/school productivity. Time spent on compulsions can disrupt performance. Physical health. For example, excessive hand washing can damage skin. Mental health. OCD often co-occurs with depression and anxiety. Have you ever felt like something had to be done even though it didn't make logical sense? Or lost sleep over a single thought running on repeat? While not always OCD, these could be signs that your mental health deserves more attention. Why OCD is often misunderstood. One reason is how media portrays OCD. Characters in movies or shows are often labeled as OCD just because they're super neat or organized. but that might just be a perfectionist personality. People with OCD may look normal on the outside, but inside they face an exhausting mental battle every day. It's crucial for us not to label others carelessly or make OCD a joke. OCD in children and teens. Kids and teens can experience OCD too. But since they're still learning how to express emotions, they might struggle to explain what they're going through. Signs can include trouble focusing at school due to intrusive thoughts, repetitive behaviors without a clear reason, excessive worry over small things. Adults around them, parents, teachers, mentors, play an important role in recognizing these signs and offering support. What causes OCD? As mentioned earlier, the exact cause of OCD isn't known, but several factors are believed to play a role. Biological factors, imbalance in brain chemicals, particularly serotonin. Genetic factors, higher risk if a family member has OCD. Environmental factors, traumatic or highly stressful events can trigger symptoms. Still, having risk factors doesn't mean someone will definitely develop OCD. How is OCD diagnosed? If you feel like you have OCD symptoms, it's super important to talk to a professional like a psychologist or psychiatrist. They usually conduct a detailed interview and might use assessment tools to understand the symptoms better. OCD diagnosis isn't based on one or two quirks. It's about how much obsessions and compulsions interfere with your life. Treatment and management of OCD. Good news, OCD can be managed. Although it may not be completely curable for everyone, many people live happy and functional lives with proper treatment. 1. CBT with ERP, Cognitive Behavioral Therapy, CBT. With exposure and response prevention, ERP is the most effective approach. It's done gradually and with the support of a professional. 2. Medication. Medications like SSRIs, selective serotonin reuptake inhibitors, are often prescribed to help balance serotonin levels. These are prescribed by psychiatrists. 3. Additional therapies. Mindfulness and meditation. Support groups. Family education. OCD and social life. Many people with OCD feel ashamed or afraid to talk about it. But the more we open up and understand each other, the more support we can give. It's important for all of us to avoid mocking or belittling OCD. Listen without judgment. Be a supportive friend. Real stories from OCD warriors. This section includes real-life stories from people living with OCD, how they sought help, daily challenges, and how they've improved their quality of life. These can be shared in a narrative or interview style. OCD is not a shame. Struggling with mental health isn't a weakness. OCD is not shameful. You are not alone. Many people go through similar experiences. And most importantly, there is always hope. If you're feeling tired from fighting your own mind every day, it's okay to pause. It's okay to talk. It's okay to ask for help. Tips to support someone with OCD. Listen with empathy. Don't downplay their experience. Encourage them to seek professional help. Don't force them to stop compulsions without guidance. Celebrate their small wins every day. Let's keep learning and listening. Still curious? In the next segment, we'll dive deeper into myths about OCD, the difference between OCD and perfectionism, how to tell OCD apart from other mental health issues. Stick around. You might discover something that helps you or someone you care about. Let's keep this conversation going. Disclaimer. This article is for educational purposes only and is not a substitute for professional consultation. If you think you might have OCD or any other mental health condition, it's best to speak directly with a psychologist or psychiatrist. They are the best people to help you. Remember, it's absolutely okay to ask for help. You are not alone, and you deserve to feel better.